Okay, so now once all life-threatening issues have been addressed, now where do you begin? There's always steps that need to conclude, like labs need to be drawn and things need to happen before possible antibiotics are given. So you know that cultures need to be done before you draw labs. I mean, you need to be doing cultures and labs, and then you need to do that before you hang antibiotics. You also need to worry about doing your labs before you do a heparin drip. You need to consider the patient is showing signs of high blood pressures without a diagnosis of hypertensive. You just need to be able to recognize what is different for this patient before they came in. Knowing their baseline will help you prioritize the patient and know where to start. So now that we've addressed how to prioritize, what kind of skills we're using, what type of processing we're using to weed out which ones we're beginning with, let's go over just a couple touch-up questions to see where you stand and where you would go from then. So in the situation is the nurse is assigned to care for 4 clients and planning client rounds. Which client should be the first nurse assessed first? 1, a client scheduled for a chest x-ray. 2, a client requiring daily dressing changes. 3, a post-operative client preparing for discharge. A client receiving nasal oxygen who had difficulty breathing during the previous shift. Well, the answer is 4. Your airway will always be your highest priority. The nurse would attend the client who had been experiencing an airway problem first. The client described in option 1, 2, and 3, they need to be identified, but it's not a priority. So this is one issue of how you prioritize care by using your ABC method. So that's just one way we would do it. You always need to look at the different patients and how to approach a situation. And everything that we learn in school, yes, it teaches us the different, things that we might see somewhat out in the real world and out in the hospital. But some of this will just come with time. And your first nursing year will always be your most challenging, your most difficult. But as long as you stick with it, you remember what you learned in school and apply the real life, take a deep breath and approach your day as you go on, your situation, just one step at a time. Just always take a deep breath and you will be able to conquer it and prioritize. And as your nursing career goes on, you will see it will get better and easier for you to conquer each day.